同事早晨。
Members, good morning. I'm the Deputy Chairman of the panel on Welfare Services, and on the instruction of the Chairman, Mr. Chan-pan, I am presiding over the panel meeting today. The reason is that members from the DAB had to stay home in recent days, and I hereby wish everybody good health. We shall get started. Please be reminded to switch on your camera when you speak and use the color background specified by Legislators. We have a number of items to deal with today. First, since the last meeting, 5 letters were received. Please refer to the letters as published on the Legislators website. Items for discussion at the next meeting. You can refer to the list of outstanding items for discussion. Earlier, the chairman and deputy chairman of the panel had a discussion with the Labor and Welfare Bureau, and they proposed 2 items at the next regular meeting in March. That is, adjustment to the income limits of the Working Family Allowance Scheme and to expand the $2 concessionary fare to cover services such as red minibuses. Dr. Teck Chi-yun proposed a discussion item for next time. Dr. Teck, please. Thank you. Chairman. From April, subvention for NGOs would be slashed, and this is of much interest to the welfare sector. This would be implemented in April, so I hope that we can have a discussion at our meeting in March so that we can express our views. Chairman, I think convening a special meeting is a good idea. I believe many NGOs, including operators and users, want to express their views at Legislators. If this could be done next time, then it would be great. If not, we can convene a special meeting to allow stakeholders from the welfare sector to express their views. Thank you. Mr. Chao Siu-chung. Good morning. I agree with Dr. Teck. Am I coming through? Yes. Welfare expenditure has grown in recent years, but in terms of funding for subvented organizations, it has been shrinking. So my concern is that this would affect the quality of frontline services. Frontline workers face a very heavy workload already, so if there's further decline in funding, the establishment could be affected. Reverend Peter Kuhn and Ms. Lam So-wai. Reverend Kuhn. I agree with Dr. Teck. In light of the pandemic, the welfare sector has come under great stress. I think we should have a proper discussion on this. The move goes against the spirit of block allocations. Ms. Lam So-wai. Thank you. I support Dr. Tick's view. NGOs provide personalized services to users, so a 1% reduction in funding would affect the quality of services, manpower provision, as well as pay, and this would really affect the morale of the staff. So hopefully we can have a discussion at the panel. I believe members agree with the three proposed discussion items for the March meeting. That is, adjusting the income limits to the Working Family Allowance Scheme, reviewing the childcare services, and 3, amending the Disability Discrimination Ordinance to expand the $2 concessionary fare. Dr. Tick proposed discussion of the reduction in funding for subvented organizations. Myself and the chairman told the Labor and Welfare Bureau that we should have a discussion on that. Myself and the chairman would relay everyone's views to the Labor and Welfare Bureau to see whether we can have an early discussion on this item. Anything else? If not, we will move on. Proposals to appoint subcommittees on policy issues. That is the setting up of working groups under the panel, and this would be considered together with subcommittees to be set up under the House Committee. So I believe members have an idea on the situation already. Anyway, the panel would deal with proposed subcommittees under our ambit. Before the meeting, I received letters from 2 members requesting the setting up of 2 subcommittees. I would first invite Mr. Chan Pan and Ms. Judy Chan to tell us briefly why they wish to set up the subcommittees. We can then move on to a vote or expression of views. Mr. Chan Pan. I believe we should have a discussion on our elderly residential care services. The waiting time is too long and many elderly people would pass away while waiting. I sent in a letter and I wish to discuss 5 items. First, the standards for the waiting time for residential care places, reviewing the subvented and new RCHE places, and 3, a review of the RCHE's ordinance. I believe it will be amended this year, and we are looking for improvements. Many operators intend to construct RCHEs, so are there any corresponding measures? And we also want to discuss other possible options. Ms. Judy Chan. Thank you. Chairman, please switch on your camera. In light of the child abuse cases at Children's Residential Home, it was of much interest, and we convened a meeting earlier as a result. Ms. Chan, can you start again, please? I propose setting up a subcommittee on issues relating to policy on monitoring child protection agencies. and there were lots of concerns over the incidents at Children's Residential Home. We convened a special meeting with the Labor and Welfare Bureau. By setting up a subcommittee, we will be able to exchange views with the relevant parties at LegCo. It is not just about an investigation into such incidents. More importantly, we need to ensure that they would not happen again. So in terms of providing oversight, training, recruitment, emergency support arrangements, etc., we hope to take in the views of different professionals. There is an urgency to the issue. So if we can appoint this subcommittee as soon as possible, work could be wrapped up by December. So I call for member support. I'd like to point out that any subcommittees must complete their work within 12 months after activation, and they would have to submit a report to the government. Other members can offer their views freely on top of these two proposed subcommittees, and all these proposals would be submitted to the House Committee. So in terms of the actual appointment and priorities, myself and the chairman might not have a say. So we can have a brief discussion on this. Dr. Tik-Chi Yang, Mr. Lee Sai-wing, please be concise as you speak. I support these proposals. On Mr. Chan Pan's proposal, I think we can expand its ambit. Manpower resources are key to the elderly care services. Currently, there's a severe shortage, so we can incorporate that in the proposal. Mr. Stanley Lee. I support both proposals, especially Ms. Judy Chan's proposal. The government indicated that we might have to wait till next year to wrap up the work, but I think there's an urgency to the matter. Apart from the incidents at Children's Residential Home, I think protecting the welfare of children should be our priority, and we should have a discussion as soon as possible. Like I said, I support both proposals, but there's an urgency in protecting the interests of children. Does any member object to Mr. Chan Pan's proposal to set up a subcommittee on increasing the provision of residential care places for the elderly? No objections. And secondly, does any member object to the appointment of a subcommittee on issues relating to policy on monitoring child protection agencies? I see no objections. So in the name of the panel on welfare services, we would submit these two proposals to the House Committee for issues that you deem to be urgent. You may want to do some lobbying among yourselves. And any member can propose subcommittees by writing to the panel. Item number 3.
So I see that we have all the speakers for the next agenda item. So after the government officials have been introduced and after the secretary has spoken, you can press the button to speak. So, agenda item number 4, we have a briefing by the Secretary for Labor and Welfare and Secretary for Home Affairs, speaking in relation to the Chief Executive 2021 Policy Address. We have the government officials, so I won't go through the full list of officials, and we also have the representatives from other institutions. We have Mr. Chan Jik-ji, Permanent Secretary Chan Siu-yam, who are in attendance. So I will clear out the queue and we will have a new queuing arrangement. So please take note. So after our secretaries have spoken, I will tabulate the number of speakers and allot speaking time. So now we'll clear out the queue and have the Secretary, Mr. Luo Jigong. So the paper has been tabled. I'll be brief. I'll be talking about the work in the coming year. Regarding the elderly, in the second half of the year, we will be combining the normal and the old age allowance. And put simply, we will allow for a higher subsidy, and the means tests will be relaxed, and it will be implemented in the second half of the year. Another work item that has already been started but not completed, we have 19 centers, and we will be strengthening the services provided to preschool children. Just now, a member also mentioned that this is an urgent issue regarding reporting of abuse of children and the legislative amendment. So a lot of work has to be coordinated, and we hope that in the second half of the year we can submit the bill. We also have on-site preschool services. Starting from this scholastic year, the quota will increase from 9,000 to 10,000. Regarding residential care, homes, one area we want to serve is to take the Guangdong RCH services and expand that to cover more Greater Bay Area cities. So that is one important task. We also want to monitor the application for social allowances, and we also have leave allowance that needs to be further streamlined. The next agenda item will be talking about the legislative amendment regarding RCH. Another area we want to cover is regarding the future restructuring of the government bureaus. In our previous meeting, we talked about restructuring the Labor and Welfare Bureau, and we would like to discuss the role of Labor and Welfare Bureau. We also have Home Affairs Bureau colleagues in attendance, so I won't overlap the discussion items. I'll let them deal with it. So that would conclude my brief. Thank you. So before Secretary Chan Jik-ji speaks, I'd like to remind you, if you have questions, if you wish to speak, you have to press the button. I have 17 members who wish to speak now. If you have questions and wish to speak, so after Secretary Chan Jik-ji has spoken, press the button. So after the Secretary has spoken, we will draw the line. Acting Secretary, Mr. Tanjikji, members, I will go through Home Affairs position on the Community Care Fund and other related issues. Regarding the Family Committee, we will coordinate with other bureaus and departments, and we will fully consider the perspective of the family. They have also appointed a consultant to look into the policy objectives. There has also been an assessment framework established for different bureau and department to assess the impact of policy on families. So we will continue to conduct different activities, and through different channels we will promote the values of the Family Council. We will promote family values, and through different media we will promote our messages. For example, through TV, through the internet, we will create create pieces of public information, and the theme will be around family values in order to enhance the public's awareness regarding harmonious family. In 2020, we had promoted a framework to support NGOs. So the theme would be on divorce management, single families, how to prevent family conflict. So we conducted activities along these three themes, and we will continue to conduct studies and surveys to help the relevant bureaus and departments to provide support. Regarding social social enterprises, there were 260 in 2008, and we now have more than 660 social enterprises. The target audience is varied. The public have a greater awareness of social enterprise, and we will promote our message through different media. We will try to drum up more support for social enterprise. So we will also have funding support for, we will provide training and other support for social enterprises to enhance their capacity. We also have some funding to help them launch their programs, and we also want to help them, the social enterprise, develop. We continue to have a social enterprise summit. So through funding, we can help them develop their services. We continue to have a partnership program and help the establishment of more social enterprises, and they can help with serving the disadvantaged community. Now, since the launch of the program, we have subsidized more than 260 programs, and they have been serving more than 6,800 persons. Regarding the Community Care Fund, we have now launched 59 assistance programs, and some of these programs have been regularized. Now, in order to subsidize households, low-income households, in January last year, we had one-off living subsidy for low-income households not living in public housing and not receiving CSSA. So in the first round, we have issued subsidies to more than 110,000 applicants, and in the second round, more than 120,000 households have received funding. So in the policy address, we have also talked about restructuring of government, and on 12th of January this year, in the first Legislators meeting, there have been some recommendations for the restructuring of the next term of government. So the items relating to Home Affairs Bureau, please refer to the document issued on the same day. It's also included in the annex for your convenience. Now, ever since the CE mentioned restructuring, the Home Affairs Bureau has been promoting this idea and has received substantial support. We are happy to hear your feedback. Thank you, Chairman. Thank you, the Secretaries, for your opening address, and I'll now read out the list of members who wish to speak. We have some 18 members who wish to speak. Yang Man-yu, Lei Sai-wing, Dik Ji-yun, Zhou Xiu-chong, Gan Wei-man, Leung Yuk-wei, Chen Man-ki, Lam Jing-yun, Tien Bắc-san, Hon Man, Chung-hung, Ka-piu, Kok Lai-ling, God Pui-fan, An Man-yu, Lam Man-gong, Lam So-wei, and Chairman Chung-hung. So 18 of us, and we have to wrap it up in an hour, so 3 minutes each. And please turn on your camera, and then Lisa. Thank you, Chairman. First of all, I support the merging of a normal and high age allowance. And I would like to relax the means to 1 million. And second, I support expanding the Guangdong RCH scheme, but I hope that it can cover large cities in the Greater Bay Area. I also hope that the whole government can look outside of Guangdong, because aside from Guangdong, I am aware that a lot of people live in Fujian and Hainan province. So could the government think about that as well? And we also want to relax the leave allowance. When people come back to Hong Kong, they have to stay in Hong Kong, but they don't have a residence. So we need to shorten that 1 year period. So maybe 3 months to 6 months. That would make it convenient for people living on the mainland. Regarding the CCF, there should be a dental allowance. In the past, there was a dental allowance, but it's not sufficient. So could the government provide a double allowance for dental care? Secretary, regarding the old age allowance, there has been a lot of discussion. With the merger, the normal and higher old age allowance will be adjusted. So how many people will benefit? It's an estimate, because we don't have a method to determine the assets of the recipients. Now, there had been some estimates some 10 plus years ago, but according to census and statistics, these figures are not too reliable. So any policy, we have to be very careful. Our estimate, if we adjust the normal living allowance, then there would be a lot of elderly who would benefit. So we have to be very careful, because it involves a substantial amount of public funds. Regarding the GBA development, policy-wise, a lot of support can be provided. So how can we work with NGOs or private enterprises who have experience in providing RCH on the mainland? We need to maintain standards. So the GBA has advantages, and the focus should be on the GBA. So if we cover too wide an area, I think that might not, we might not be able to achieve a beneficial outcome. So we have to maintain perspective. Regarding the third question of leave allowance, we have to be careful in dealing with people leaving Hong Kong. we would like social services provided to people with intimate relations with Hong Kong. So if it's too lax, then the whole welfare funds might be abused. We have to be careful.
I will take the fourth question about the community care fund. I'm the chairman of the CCF task force. We are now into the second round of elderly dental services, so we will keep tabs on the situation. Mr. Stanley Lee. Thank you. Please switch on your camera. On childcare services, there has been a lot of concern over the incidents at children's residential home. There's a serious shortage of childcare services for preschoolers under 3. While the CRH incidents show that there only 2 NGOs were providing the services. So in terms of the way forward for preschooler care services, what is the way forward? As for the Guangdong residential care scheme, we hope that it could be extended to other cities in the Greater Bay Area. The 2 homes are currently operated by NGOs. So while expanding the scheme, will the government consider involving privately run homes so that eventually more care homes would take part in the scheme? In terms of merging the normal and higher old age living allowance, it has been discussed for some 2 years already. If this could only be implemented by the second half of the year, is there any way to streamline the administrative procedures in order to expedite the work? Secretary, in terms of childcare services, including both, well, we are looking at daycare and residential care services. For daycare services, a few years ago, a review was completed. The manning ratio was improved. So in the gist, we saw an improvement already. In terms of subsidy level, the government would shoulder the additional manpower costs, and a new subsidy was offered for families. So in terms of residential care, indeed there's a serious shortage for children aged 0 to 3. So there are plans to reinforce the services as soon as possible. As for expanding the residential care scheme to other cities in the Greater Bay Area, for NGOs or private companies with a track record in Hong Kong, we would carry out quality assurance. So far, only Shenzhen and Zhaoqing have these homes, and hopefully homes could be introduced in other GBA cities. As for merger of the normal and higher OALA, a year or so ago, I have said that the work would take time. We talked about it in January 2020, but due to the financial deficit and other factors at the budget last year, we explained that we had to assess our financial position, and eventually we made a decision, and it would take about 18 months to refine our systems, etc. So we are looking at a fundamental change. We need to reprogram the entire system. That is why the work would take 18 months. Hopefully, the review could be completed by the 3rd quarter this year. Dr. Teck Shih Yuen, Chairman. I'm against the slashing of welfare expenditure by the government. The welfare sector has always criticized the government of lacking a long-term plan in welfare facilities. According to the paper, well, the rehabilitation program plan and another program was mentioned, and the government would adopt the approach of implementation as and when ready. And in the elderly services program plan, a lot of proposals were mentioned. So how many of these will be implemented? Welfare facilities could be provided in private sites. Could such provisions be inserted in the land lease conditions? In terms of legislation, I support legislation for a mandatory reporting mechanism for child abuse cases. As for the proposed offense of failure to protect children, is there a legislative timetable? Dr. Law. The government would certainly not jeopardize the welfare of the vulnerable. That is our principle. As for the rehabilitation program plan and elderly services program plan, I think it would not be possible to answer this question in 1 minute. I believe later we would have the opportunity to explain these in detail to LegCo. Since a few years ago, we have added provisions on welfare facilities at appropriate sites, including residential care homes for the elderly. An elderly home occupies substantial floor space, so due consideration must be made. As for the duty of care, this would be explored together with the proposed mandatory reporting mechanism. There were case laws relating to the duty of care already. There was a recent case in which a person was sentenced since he or she did not exercise the duty of care. So I call for members and the Secretary to be brief when they speak. Mr. Chao Siu-chung, followed by Ms. Ka Man-yu. We saw recent cases of child abuse, and this shows a serious deficiency in the oversight provided by the SWD, and it makes us think about the deployment of frontline workers for elderly care and child care. There's a shortage of manpower and the work conditions are very poor. Pay is also lacking, and that would jeopardize service quality, and that could give rise to child abuse or elderly abuse. So when reviewing the policy, the government should allocate more resources for frontline workers. Paragraph 22 of the paper talked about a navigation scheme for young persons in care services. It was launched in 2015, but there were reports saying that the scheme was not very effective. So if we are to attract talent, we need to improve the conditions of service and remuneration. So can we improve the navigation scheme so that we can enhance the remuneration of frontline workers? I have my doubts. The scheme was introduced back in 2015. What is your assessment on the effectiveness of the scheme so far? We have some 70,000 RCHE places. The occupation is less than 60,000, or about 80%. So will the government introduce more bought places so that the waiting time for RCHEs can come down? In terms of the manning ratio for childcare services, it was enhanced in 2018 to 19, and these included both home care and residential care services. As for residential care services, whether the ratio is adequate now, this is something that will be reviewed. When we reviewed the manning ratio for childcare services in 2018-19, we saw that it wasn't easy to recruit childcare workers, and training was needed. So at that time, the idea was to adopt a gradual approach, but there was no long-term plan at that time. So we will be reviewing the overall provision of residential care services. For the navigation scheme for young persons in care services, it was launched a few years ago, and you could see the wastage among or within the scheme. For many young people, within a year after they graduate, about 30% would quit. So for the navigation scheme, the wastage is still relatively high, but this is in line with the wastage among young people in general. In 2019 to 20, when we relaunched the navigation scheme, we improved the salaries substantially and reduced the number of working hours to facilitate training. So we will continue to monitor the scheme going forward. For RCHE places, it could take 7 to 8 years to build new facilities, and that is why we must identify short, medium, and long-term options to tackle the shortage. So we have said in the policy address a few years ago that for 5 straight years, we will introduce 1,000 extra bought places. This is the equivalent to 10 new subsidized RCHEs every year. Thank you. Ms. Carmen Khan, followed by Mr. Kenneth Leung. Thank you. Some members of the public, especially pregnant women, express concerns over vaccination, and then I'd like to offer my views on government restructuring. As we all know, in order to boost vaccination rates, the government will launch the vaccine passport, and the employment ordinance will be amended to allow employers to reasonably dismiss employees who are unvaccinated. A lot of pregnant women are concerned about this, and this is something of concern. And pregnant women could only receive the community vaccine, and if they are to enjoy exemption, they must produce medical proof. I'd like to know the government's stance on this.
So I hope you can handle the pregnant mother's concerns. because with the amendment of the labor ordinance, will they be exempted? In the government restructuring regarding the MPF, the funding will be directed to the labor bureau, so having them coordinate would be ideal. Regarding manpower policy, I think that should be handled by the chief secretary because they would also cover education. The poverty council would also take a part in that, and I understand there'll also be some changes, so the child council and women's council terms of reference could also be reviewed at the same time. Thank you, Ms. Kant, for your first question. Now that is the ambit of health bureau, health and welfare. So secretary can decide whether you want to answer. That would be the ambit of the manpower bureau. Now we will consider any changes to the employee ordinance. So if there are any changes to unreasonable dismissal, we have to consider any contradictions to the law and policy. We will look into that. Ms. Khan also had a second question about the restructuring of government. Who can answer that? Now, the relevant work regarding the Women's Council, women's rights, that would touch upon a lot of organizations and NGOs. So having it dealt with by the Home Affairs Bureau would be appropriate. Regarding child protection and women's rights, that is also the ambit of Labor and Welfare Bureau. Like, international affairs would be the department, would be the ambit of a separate bureau, but anything relating to children in the future, it will all come under the umbrella of the Labor Welfare Bureau. Of course, we have the Child Council, and we suggest that that can be chaired by the Chief Secretary. So put simply, the work will still come under Labor and Welfare Bureau. Leung Wei and then Chan Man-kei. Thank you, Chairman. I'd like to ask, in the recent year, domestic violence and child abuse, these cases have been increasing according to Social Welfare Department. There has been an increase of 45% and 70%, and we also see increase in domestic violence. So I want to ask, the family support needs extra funding. Do we have the resources? Do we have any prevention plans under COVID? So I also want to ask Home Affairs Department that you do have programs to support families. You have programs to prevent family conflict and domestic violence. So I'd like an update on the progress. Is there any progress update you can share with us? Just now, we also heard a question about funding cuts to social work groups. I'm very concerned about that. And now, aside from that, is it possible to provide special support under special circumstances? Let's say, can there be IT support? Can we have some new programs to support social work groups to provide a better service? Secretary, I think you understand that if you compare 2020 and 2021, the child abuse cases, there was a significant increase. There are many complex reasons for arrangements under COVID. a lot of children are stuck at home, and families, for different reasons, they have to family members spend more time at home. So it seems that there is a greater amount of domestic pressure, and we also have schools returning to normal, and it has brought many new child abuse cases to light, and this reflects that there is pressure throughout society, and we have adjusted our manpower to deal with child abuse. So if they have a heavy workload, if necessary, we will add resources. Now, in the future, we will consider amending the relevant law to have compulsory reporting. So no matter how you look at it, it will increase the number of reports. So manpower deployment, how can we deal with the forecasted increase in workload? When we plan our work in the future, we will have to match our resources to the perceived increase in workload. So in the past, we had to rely on lotteries fund to assist this work. Now, we also have a social welfare fund, and the funding exercise from last year, we had looked into the use of IT and innovation to conduct our work. So we also try to help out with rehabilitation and the use of IT. Next, Ms. Chun Man-kei. Thank you, Chairman. My question is related to the elderly women. I can see from the policy address that assistance to women and policies are scattered and diverse. So will there be a study? Will there be a white paper looking at the role of women in Hong Kong? Coming to the issue of children, the Hong Kong Society for Protection Against Children Child Abuse case has reflected the lack of monitoring. So we need to step up our work. We cannot wait till next year. Will the government consider civil servants during work hours if they neglect children, or if their negligence leads to injury and fatality? Will there be a crime? Will we legislate that to be a criminal activity? Now, we also know that RCH, a residential care home, it's hard to identify a site that is appropriate. So has the government considered how to help RCH identify a site or provide land for them? Will we need to stipulate a site in future development for RCH? So does the government also monitor its own activities aside from just monitoring NGOs? So if there is a cut to welfare organizations of 1%, will you consider taking this 1%, diverting it to fraternity organizations or NGOs so that they can help share the burden of the care for elderly and children? Regarding women's policy, we are happy to discuss this in the Women's Council. Now, regarding welfare and policies relating to women, the Council can help government formulate policy. Now, last year we had a case, a legal case, and the Law Reform Commission will look into that, and when we formulate legislation, we will also consider making reporting mandatory. Now, we have to coordinate training and legal considerations and other coordination in order to have the law implemented smoothly. So that involves many professional areas. It's not just a simple legal amendment. So we will be working hard on that because it involves different bureaus and departments. So as Secretary for Labor and Welfare, I'm responsible for coordinating this work. Regarding the coordinating of facilities, some 2 years ago, we had amended the Hong Kong Planning and Standard Guidelines, and the facilities regarding to RCH, the ratio of facilities to population, that work has been completed. And in the previous year's policy address, we had added 5% of plot ratio to housing for welfare services, whilst not affecting the deployment of resources. So these are typically RCH for the elderly and disabled. Now, when the government announces the relevant expenditure or a cut of 1% as part of the 2022-23 budget, so all the resources will be returned back to the Treasury for deployment. So next, we have Mr. Lam Ji-yun. I'm aware that there are a lot of activities that need to be considered under labor and welfare. So I have a short-term and long-term questions. In the long-term concerns, I've received a lot of questions from the public. A lot of applications for social welfare assistance is becoming more and more difficult given our aging society and changing demographics. We have couples having less children. So in the long run, has the government considered a more accurate, a more focused poverty program? In the past, we are seeing a lot of cuts, spending cuts. So will there also be a consideration of how resources are deployed? So for the elderly home or home for children, it's the Secretary's responsibility. So we've also had a lot of visits to elderly homes. So the Secretary or your staff, do you have a support team to handle these issues? Why do we have elderly home workers stuck in a residential care home? They have they're not provided with food or COVID testing packs. It's unbelievable that Hong Kong has degenerated to such a condition. Secretary, regarding the question about social welfare services, typically when the government provides some assistance to the elderly or family services, whenever there is a new service provider, we will delegate it to an organization that will provide that service. It's an open exercise. We don't require specific resources designated, and they have to make an application for that. In our lotteries fund, we might have some services required. Typically, that is not a lot. These are typically based on NGOs' experience, and the government will also consider regularizing this through the lotteries fund.
咁所以就冇乜特別咧。有一樣嘢叫做大家希望提供嘅服務，向政府申請資助嘅。
In terms of RCHEs, in light of the recent quarantine arrangements, some staff members of the RCHEs were waiting for quarantine at the facility. So the health authorities would ask them to stay at the declared address, that is the residential care homes ahead of quarantine. So going forward, we will see how we can coordinate the work with the health authorities. In terms of poverty alleviation, the government has no plans to scale back on any work related to poverty alleviation. In fact, we are looking to reinforce our work. Mr. Michael Tian, Secretary, last year the government allocated $80 million to the Hong Kong Society on the Protection of Children. Altogether, 24 staff members were arrested for suspected abuse of children. I think it was a major scandal, and it did not reflect kindly on the SAR government. The SWD has never inspected CCTV footage, and they didn't know about the problem at all. I ask you to admit that the SWD's inspection regime was hugely ineffective, but you didn't have the chance to respond. So today I'm putting the question to you again. In terms of designing the monitoring regime, would you admit that the SWD urged the chief executive resigned? So why wasn't any criminal prosecution laid? How much longer are you going to wait? Dr. Lau? Thank you. We do not expect children under the age of 3 to lodge complaints for themselves or child abuse-related complaints. They are either made by their family, carers, or service providers, such as schools or healthcare professionals. In terms of these incident, some residents made anonymous complaints, and eventually the SWD and police were informed. So please do not think that we expect children under the age of 3 to lodge complaints. Secretary? Many of these children seldom receive visits, but not reviewing the CCTV footage was a failure in the system in itself. So why didn't you admit that the SWD erred? At the special meeting last time, I have said that we obviously lacked vigilance. And in terms of the oversight on the licenses issued, we promise a review in the future. In terms of any questions relating to criminal proceedings, I would not be offering my views here. Finally, would you apologize to the public over the incident? Chairman, like I said before, we admitted that we lacked vigilance over the incident and we had to improve the mechanism on oversight to avoid repeats in the future. Wouldn't you even express apology? Mr. Benson, look, according to the paper, the recurrent expenditure for 2021 to 22 will be $105.7 billion, and I have two questions. Like Dr. Tick said, the recurrent expenditure would be slashed by 1% from next year, and the budget for subvented organizations only made up about $200 million, so apparently it wasn't a high percentage, but many organizations are concerned since they often provide personalized services. Apart from their regular services, they would have to take part in anti-epidemic work. For instance, apart from delivering meals to the elderly, they would have to deliver anti-epidemic items or make calls. Many young people attend lessons at home, and counseling services must be provided to them. So if the funding is slashed by 1%, they either have to reduce pay or slash their payroll. So does the SWD have any recommendations for these affected NGOs? How can they address such change? Two years ago, the SWB was granted $60 billion to purchase 60 welfare facilities in 3 years. So can you give us an update on the progress? Since we have a $20 billion funding to acquire welfare facilities, can we create a pool of funds for SME welfare organizations to apply? As for the 1% reduction in funding, in the past 20 years or so, different schemes were implemented. So existing services would be consolidated to enhance cost effectiveness. In this exercise, we are looking to redeploy our resources without affecting the quality and quantity of services. The adjustment will be 1%. And in terms of welfare expenditure, remuneration is the key component. And as to how the NGOs can react to the 1% change, different NGOs would have different approaches. In terms of the acquisition of sites for welfare purposes, this is to increase the provision of welfare facilities such as day childcare units. Despite a decline in the number of babies, the number of aided childcare places for children aged 0 to 2 is only about 900. And this is totally different or separate from the 1% reduction. Acquisition of sites is a capital cost or capital expenditure. The 1% reduction refers to recurrent expenditure. So recurrent expenditure could not be compared against capital expenditure. Mr. Michael Look, followed by myself and Ms. Lillian Kwok. Mr. Look, under the pandemic, the FTU has been fighting for a 6-month unemployment assistance. It wasn't adopted by the government, but they did heeded the advice in spirit. I hope the welfare policies could be adjusted and certain measures should be extended, such as the relaxed number of working hours under the WFA scheme. Currently, the measure will end in May, as well as the calculation of income and asset limits for the WFA scheme. There are currently 3 tiers. The 2 lower tiers have been relaxed. For the upper tier, that is 192 hours. Hopefully, the government can relax it as well. Many people, especially those from the catering and services trade, could not find sufficient work, so they could not meet the 192-hour limit. In terms of the portable arrangement for welfare measures, the Guangdong and Fujian schemes have been relaxed. For the public security assistance programs, what is the progress on the portable arrangements? In the past, we made adjustments to application eligibility on WFA. We would monitor the situation. We hope the pandemic could be brought under control soon and that we can achieve our goal of dynamic 0. So we are monitoring the relevant measures. For the public assistance programs, we are looking at the old age living allowance, and this is an important part for many retirees. Apart from merging the normal and higher OALA later this year, we would also review the absence limit under the SSA scheme. I have 2 questions. According to the government restructuring proposal, if the LWB is restructured, the LWB would be responsible for implementing poverty alleviation. Poverty alleviation is currently involves multiple bureaus. It is currently headed by the Chief Secretary for Administration, and later it will be headed by the Labor and Welfare Secretary. Does it mean that the government is now placing a lesser emphasis on the portfolio? As for the Community Care Fund under the Commission on Poverty, the CCF has a tight balance, and without additional funding, it would be exhausted by 2022 to 23. Are there plans for the government to expand the income sources for the CCF? The FTU proposed an extra 1% in profit tax for enterprises with a profit of more than $100 million. Is this feasible?
將係
Labor and welfare will be responsible for poverty alleviation policies in the future. So this is having a policy bureau responsible is much more conducive, but regarding medical issues, housing, and so on, it's all related. So labor and welfare will help the Poverty Council. They will also have a secretariat who will play a coordinating role. So we don't have any recommendation to have the chairman of the Poverty Council this role. We don't foresee any change. It will still be led by the chief secretary. So in the next term of government, the next CE can make the final decision. And this term of government will inherit the previous practice, albeit with some minor adjustments. We still have a few more months till the end of this term, and we will need to review the development of the Community Care Fund. So the next term of government will make proposals. We haven't undertaken the work yet, but we will start the preparatory foundation. Now, it's hard for me to respond to profit tax issues as Labor and Welfare Secretary. I think it should be handled by the Finance Secretary, and it becomes internal resources redeployment issue. We typically don't have profit tax being allocated to a certain bureau. Gotling Lai and then Ms. Elizabeth Quat. Thank you, Chairman. There are a few questions I have. First, after reading the report, I see you have diverted resources to special education needs and also the physically disadvantaged. In items 2 and 4, you increase the services from 3,000 to 10,000. And we now have 80 schools that will receive these services. But the number of kindergartens and CCCs in Hong Kong, they amount to 1,000. But they only take up 0.08% of resources, so it is insufficient to serve the students that need these services. So the queuing time is 1.5 to 2 years, and by the time they receive services, you'd say they need 11 months, and so could you provide more resources to shorten the queuing time, the waiting time? We don't want the children to miss the most opportune moment for intervention. On the caregivers, we understand they are under a lot of pressure. Last year, we had a caregiver who committed suicide. We don't want to see these tragedies occur. So the government is looking into a community caregiving coupon. So when can our handicapped or disabled enjoy these benefits? And third, you want to enhance the quality of RCH. Will that include SEN facilities? Because the existing facilities are dilapidated, they don't have negative air pressure rooms. So given COVID, they are very worried with the inadequate medical facilities. So I hope Secretary can look into that. We also need family support, and the families. I've heard the government conducting studies. So what are the study results? What policies will you promote? Now, family support, involves counseling and guidance. That's not the work of a social worker. So we need more resources to help the children. There's no time for the secretary to answer. They have the on-site preschool services, the on-site services. There should be no waiting queue in the by 2024-25. There should be zero waiting time, especially for SEN. There might be a queue there, so we are adjusting the services such that the SEN waiting time can be minimized. Regarding the physically disabled, the last time we formulated a plan, especially there have been objections from the caregivers, but we have not stopped our work. We are still looking into how to provide services. So regarding SEN facilities, we will be looking into that with the Education Bureau. Thank you for supporting our family work. We have 3 substantial family values: communication, respect, and harmony. So we will provide input to the relevant department. We will also conduct studies, and Ms. Hawk asked a question about consultant studies and the fact that we have done a lot of family support studies, and recently in the middle of the year we will have completed a few studies. Especially we have studies looking into divorce and family conflict and so on. Just now we also heard about domestic violence. So the Family Council will be dealing with these issues, and hopefully through the 3 core values we can resolve domestic violence. We still have 4 members of Ka-piu from Elizabeth Court, Leung Man-gong, Lam So-wai. Ms. Elizabeth Court, thank you, Chairman. Regarding Hong Kong Society for Protection of Children, child abuse incident, we might still have a lot of victims. The public there is a public outcry regarding this incident, and the government has not done its job of monitoring, so Social Welfare Department is also responsible. We need to have an independent inquiry, not only to look into Hong Kong HKSPC, we also need to investigate Social Welfare Department's role of monitoring and its role. But a more urgent issue today is that under COVID, we now have outbreak in RCH for elderly and people, and also in residential homes for people with severe disabilities. I received calls from family members. The elderly are stuck in the RCH and with nobody to look after them. But today I also received calls from parents. We know that there are 5 staff and disabled residents. They are teenagers, I think. They have been infected, and we don't know whether there'll be more cases. They are now being quarantined in the RCH, but there's a severe manpower shortage. They can't leave. Staff cannot enter the premises. So they are mentally disabled. They cannot look after themselves, and if there's insufficient manpower, how can they look after themselves? And if staff are sick, and if they don't have outside help, the situation is in fact quite dire. So parents are saying they are willing to help, and they are willing to be quarantined as well. But nobody can answer their questions. So we'd like to ask what the government can do. We are concerned about the RCH for disabled, for the elderly and disabled, and especially if staff are infected. The Asia World Expo facilities are already at full capacity, and even though we have made adjustments to our workflow, we still have a severe bottleneck, and a lot of the RCH, they might have to be relocated to quarantine centers. We are working, even though we're working very hard, it still takes time. We need to retrofit some facilities to provide quarantine facilities. We also need to employ extra manpower to provide care. So how do we help the RCH who need to be quarantined? How do we quarantine the residents and staff? We're working very hard with Health Bureau. I need to say that we were aware of the problem in mid-January, and we were working hard to increase capacity, especially quarantine capacity and testing capacity. Now we've increased capacity by 60%, and the target is to increase it by 4 times. But the infection figures are going up tenfold, and our past measures are not effective anymore. So every day we need to adjust our strategy, and we need to redeploy resources. So we've done our best, and this is almost like a war. Our colleagues are working flat out, and they are working very hard. Squad, your time's up. So the agenda item has to conclude at 12:25. So after drawing the line, Han Yong and Holden Chow wish to speak. Now I suggest that after Lam So Wai, after they spoken, Chan Yong and Holden Chow can speak, but they will only be given 2 minutes because the line was drawn. So I also have to handle 2 issues. Leung Yuk Wai has said that his question involves Home Affairs Bureau and Family Council support program, but there was no response or no time to respond. So Home Affairs, can they provide a written response? Gan Wai-man also asked a question. She wants to clarify whether pregnant women can be exempted from unreasonable dismissal because they are not vaccinated. So I repeat, that is a health and labor issue, especially if it involves amending the employee-employee ordinance. So I hope Ms. Khan can follow up in a separate venue. I repeat, An Man-yu, Long Man-gong, Lam So-wei, and Chen Yong, Zhao Ho-ding. So 3 minutes for the first 3 speakers. Ms. Man?
Thank you. I've always been concerned about unemployment and underemployment. For special schemes launched, including the relaxation of income limits under CSSA, these measures are about to expire. I'd like to know whether these would be extended. And some members said that the WFA scheme can help people who are underemployed. I'd like to know whether there could be further relaxation on the working hours. We talked about the related measures. We will continue to monitor the situation. And some of them require approval or vetting by Legislators, so we will certainly update Legislators on this. As for further lowering the working hours requirement under the WFA, that would fundamentally change the design of the program. So we will be monitoring the situation in the coming months before reporting to Legislators. Thank you. You still have 1 minute and a half. Mr. Ngan, any follow-up question? For the unemployment assistance that would be implemented soon, for those without who cannot show proof for MPF, there would be an alternative arrangement. I believe you can adopt the approach of requiring a self-declaration. That would prevent potential abuse. At the Finance Committee special meeting tomorrow, I believe we can have a discussion on that. I will not offer a response here. Mr. Leung Min Kwong. Mr. Leung, am I coming through? Thank you. I have 3 questions. Some members talked about relaxing the Social Security Assistance Program. According to the population projection last year in the mainland, it showed that we have some 300,000 people living on the mainland, including places like Guangdong, Fujian, Shanghai, etc. So will the coming review consider expanding the scope of the benefits in the mainland in terms of promoting sharing technology? In the past, the Innovation and Technology Fund for application only applied to care homes. So for CSSA recipients, can certain funding be extended to the purchase of equipment? As for the navigation scheme for young persons in care services, according to surveys, only some 30% of the people would enter these programs or the industry. So we wonder whether more resources can be provided under the scheme to facilitate training, and that more resources could be provided for these young people to enter the trade. Dr. Law, please. In terms of providing support to those living on the mainland, currently it applies to the Guangdong and Fujian provinces due to their close ties to Hong Kong. We focus on the Greater Bay Area. So in terms of GBA development, policy support could be more focused. So going forward, we would focus on the GBA. In terms of Yearn technology, the Hong Kong Coalition of Social Service is currently backed by the Hong Kong Jockey Club to provide leasing services. Once the community care vouchers are released, leasing of certain equipment could be enabled, and this is something on our agenda. For the navigation scheme, like we said earlier, after the scheme was reintroduced in 2020, we raised pay and lowered the working hours requirement to facilitate training. We understand that young people are looking to develop their careers, so we hope those who join the scheme can continue to work in the sector. So many young people who left the scheme did so in order to receive training in different fields such as physiotherapy. I think a 30% retention rate is not bad at all. Ms. Lam So Wai, 3 minutes. As for the study on supporting carers, is there a completion timeline? I'm concerned about the support and subsidies offered to carers. Hong Kong's population is aging rapidly. Our carers are taking care of patients around the clock, and the PWDs face great pressure, both physically and financially. And under the CCF, there are carers subsidies, and currently the measures are not very adequate. For those waiting for subsidized care places, the average waiting time is 18 months. Carers face great stress in taking care of these elderly people at home. In terms of carers subsidy, a pilot program is being implemented. The SWD invited applications from these carers. Invitations were extended to the families of some 80,000 elderly people and 20,000 PWDs, but only 8% filed an application. So in terms of enhancing financial assistance to these carers, including making regular the subsidy for elderly or PWD carers, since the application threshold is very high, many carers are deterred from making an application. So the threshold is 80 hours of care every week, and there are family asset limits. Many carers who have full-time work indicated that they could not meet the threshold or asset caps. Only about 4,300 people applied. Given with the subsidy level of about 2.3 thousand, the government expenditure is only about $100 million, while the recurrent welfare expenditure for the previous year is more than $100 billion. So it shows that the financial commitment is negligible. So we should make regular the subsidy for carers and relax the application threshold substantially to allow carers of PWDs and the elderly to apply. Thank you. Once the study is completed, we will brief members. That's all I can say at this stage. Mr. Chen Yong followed by Mr. Holden Chow, 2 minutes, including question and answer, please. Thank you. In terms of the reduction of funding, I understand your financial position, but I know that the Jockey Club charitable fund or other funds, could they replenish the reduction in order to offset the impact in terms of elderly services in the Greater Bay Area? We fully support the idea. The Secretary can launch more pilot programs. Many district organizations and kinship associations have helped battle the pandemic. So we should incorporate their resources as much as possible. For child abuse, this is a serious problem to be tackled, or else we would see more contraventions. Secretary. The reduction is on recurrent expenditure. If other funds are available to help the NGOs, of course, we would welcome the idea. But this is a permanent reduction by the government. In terms of new services or enhancement of services, new resources will be available in the future. So 2 weeks later, the budget will talk about reinforcement of current services or introduction of new services. So this is not a short-term issue. The 1% refers to the baseline expenditure, so it is permanent. So we are happy to have a discussion later, but since time is limited, that's all we have to say right now. Ms. Odin Chow, thank you. Am I coming through? Thank you. Secretary, I have 2 points to make. For the Guangdong and Fujian schemes, we talked about the relaxation of the absence limits. Very often, the elderly people are already on the mainland. The 1-year continuous residence requirement is a hurdle for them. So we want to see how this could be relaxed. As I said on other occasions, for the idea of social nannies, Secretary, you talked about this last time. We understand that their work is almost voluntary in nature. You are giving them an allowance of some $20 per hour. The pandemic has changed the situation in Hong Kong. So going forward, can social nannies be made full-time and more systematic instead of just offering them $20 an hour? So can we recognize them properly? I believe there would be a great demand in the future. Thank you. Chairman, in terms of the absence limit under the Social Security Allowance scheme, at the Welfare Services panel last year, I believe Mr. Horace Chang raised the idea, and in the policy address, we have said we are exploring the issue. Mr. Chow talked about social nannies, full-time nannies do exist in Hong Kong. Some families would leave their children with paid nannies in the neighborhood. Given the current legal constraints, there are no provisions on childcare services, but in light of the pandemic, we realize that we need to pay more attention in the future. Together with the LWB and SWD, I would explore the arrangements for full-time nannies in the future. Thank you. Dr. Law. We have the Acting Secretary for Home Affairs in attendance today. Some members asked about the family-friendly policy and assistance programs, so I'd like to invite Mr. Jack Chan, the Acting Secretary, to offer a consolidated response.
Thank you, Chairman. Just now, Mr. Leung Yuk-wai asked a question about family council. Because of time constraints, I could not respond. Now, if Chairman and Mr. Leung Yuk-wai are, when I responded to Kok Ling Lai, I had answered this question. Let me repeat. The family council attaches a lot of importance to the family. We did a lot of studies since 2016. In the latest round of studies, we included 3 topics: divorced families, second, education in divorced families, and third, divorced families and remarriage. So we look at how to prevent family conflict. So regarding these 3 topics, we have approved 4 studies, and these 4 studies should be completed by the middle or end of the year. So when the study is completed, we will report back to you. Thank you, Chairman. So that concludes this agenda item. We now handle agenda item number 5. Legislative proposals for enhancing the quality of residential care homes. Now we are late by 6 minutes, so we need to take note of the time issue. All EdgeCo members are invited for discussion. The Secretary had also prepared background information for your reference, and we need to clear the queue, and just as with the previous item, when after the secretaries have spoken, we will count the number of members who wish to speak, and I'll draw the line. We'll announce the number of speakers, and we'll calculate the speaking time. So the official in attendance, we have Undersecretary for Labor and Welfare, Mr. Ho Kai-ming. So I also want to repeat, when Mr. Ho is speaking, you can press the speak button. So after the Secretary has spoken, we'll draw the line. So, Undersecretary, Mr. Ho Kai-ming. Thank you, Chairman. We have 1,100 RCHs, and the government has 19 recommendations, and 14 of them involve legislative amendment. These involve CAP 459, CAP 459A, CAP 613. Now, I'll skip the background, and of the 14 legislative amendments, I'll have Ms. Polly Cork take us through a PowerPoint. Chairman, I'll go through the legislative amendments. I'll focus on manpower and per person living area amendments. Now, regarding the minimum manpower, according to the recommendations, the nurses and caregivers in the future, there has to be 1 nurse for every 13 hours and for every 60 residential residents. We also have other duty nurse requirements for for every 60 residents. So for 60 residents, there has to be one caregiver for on duty for 6 hours. Now, there's a lot of concern over manpower, so we will implement the number of nurses and caregivers requirements in phases. So in the second year of the legislative amendment, if there are more than 60 residents in the RCH, they have to meet the requirement. So for less than 60 residents in RCH, the Secretary for Labor and Welfare, according to the gazettal notice, they will announce when they need to comply with this requirement. Regarding caregiver and other staff, we suggest extending the caregiver and residents ratio of 1 to 20. The number of hours will be extended from 8 hours to 10 hours. We also want to extend the ratio of 1 caregiver to 40 residents on duty hours from 7 hours to 14 hours. For interim residential care house, the number of the caregiver to resident ratio 1 to 40, we require 11 hours of the caregiver being on duty, and we need to have 1 caregiver and 1 staff on the premises. So according to the residents' actual needs, they can arrange, they can make these, they can handle the work hours scheduling, but they need to receive approval from SWD. Now, according to the study group's recommendations, we will have a minimum area of 9.5 square meters. The minimum will now be adjusted to 8 square meters, and according to the work study group suggestions, for residents in high care residential homes, for license applications, in the 4th year of the legislative amendment, they will have to comply, and starting from the 8th year, the area requirement will be 9.5 square meters. For low to medium care homes, in the 8th anniversary of the legislative amendment, they have to meet the 8 square meter requirement. Now, regarding the license holder, what constitutes a suitable candidate, we have made a definition, and the applicant definition will have to be considered, and in the future, for new RCHs that apply for licenses and extension of license, we need to have a designated person, a responsible person, and that person needs to comply with RCH ordinance requirements. If the Director of Social Welfare deems that person is not a reasonable person, we can require that residential care home to appoint another person. Now, when there is a breach of the ordinance, aside from the responsible person being liable, any negligence or the person who has been negligent will also bear criminal liability. So even though we don't have a licensing regime, but according to the study group's recommendations, we will create a registration framework. Now, the valid period has been presented in our paper, and we also suggest creating a registration system for caregivers. There is no extension period, but in order to maintain standards for caregivers, we suggest that there be an extension mechanism. So Director of Social Welfare, when they extend licenses, they can adhere conditions such as continuing studies conditions. We will also require residential homes when they deal with medication, when they deal with restraints and privacy issues, that we will have some regulations in place. So the Director for Social Welfare can issue a written notice when there's no compliance to these rules. There can be a penalty. Now, we also included penalties for unlicensed operations, or if the operator has contravened regulations, or if they prevent fire services department from inspecting the premises, we have increased penalties. Now, we in Annex 2 we have listed the different implementation dates. Thank you, Chairman. That concludes my report. So we have received a request for some 7 speakers: Hon NGAN Man-yu, Ka-piu, Chung-hung. Have I omitted anybody? Is there an 8th person who wishes to speak? If not, then I'll have to draw the line here. Well, I'll give you 3 minutes for Q&A. So, and as chairman, I'll extend the meeting till 1:15. And thank you, Chairman. So increasing staff and increasing the area can improve RCH quality. But the first question I have is, has the government assessed how many RCHs need to upgrade facilities, and what is the impact on costs? I'm not speaking on behalf of them. I worried that the RCH will have to hike their fees, and the elderly might not be able to afford the new fees. The second question: why do we need 8 years to transition? If they hike the fees, they'll hike immediately, but why are they given 8 years to comply? Now, I am concerned about manpower. Now, the RCH for youth scheme didn't work very well. Only 30% of people stayed in the industry. They either have long working hours or low pay, and there are no promotion prospects. So we have 12-hour shifts, and for imported labor, they only need to work 9 hours, but our local workers don't have these constraints. They have to work 12-hour shifts. So not too many people can stay in the job. Regarding foreign labor, there is no supervision. So we have a lot of uncompensated work. I am dealing with a case that involves a lot of workers. They have docked pay, uncompensated labor. So each person is owed more than 100,000. So I want to ask the Secretary, how can you, what will you do to handle these manpower issues? Well, we'll see if Ms. Kwok-Welling has time to answer the question. So the 8-year transition, it is a big change. We are creating a new environment, and especially for private RCH, they will have to undergo a large change. So whether 8 years is a long period, well, it takes time for them to transition, and we don't want the residents to feel rushed. We also have to work with Labor Bureau. So how do we handle that? We will discuss that with the Labor Department. Chairman, let me say that we have some 1,124 RCH for elderly and disabled, and some 470 of them have not met the per person's area requirements. So they need to adjust. They have to reduce the number of residents to meet these requirements. But I hope members can take note that regarding subsidized homes, only 7 don't meet the requirements. So the majority of subsidized homes meet our regulations. For private homes, they need more time to meet the regulations. For bought places and the resident coupon, if they participate, the government can help them meet these requirements.
Yeah.
Dr. Teck Chi Yun. Thank you. Good morning, Under Secretary. I believe the legislative exercise would help improve the quality of RCHEs. Like the government said, this would help enhance the quality of private RCHE services, so I support the proposal. But I'd like to highlight a few points. First of all, manpower. Both the reinforcement and improvement of manpower. Many care homes are finding it very hard to recruit. There is a shortage of manpower everywhere, and this would affect the quality of services as well as the users. The Undersecretary said he would discuss the matter with the LWB. I think this is a structural issue, and this is a long-standing issue that we have seen over the past 10 years or so. Hopefully, together with the HKCSS and other stakeholders, a working group should be set up to improve the manpower structure. There's no way we can compete with the hospital authority. So the more health workers and nurses you train up, they would end up in another sector or profession. So we can only improve by tackling the root of the problem. The second issue is cost. An improvement in service quality would mean rising costs. Some service users who are not using subsidized or bought places, how would you deal with their rising costs? Otherwise, if the cost is shouldered by the grassroots or vulnerable, it's certainly not ideal. Thank you very much for your support. In terms of costs, we know that the costs might go up in the future, but it's most important to provide support to the LCHEs. So we would look to provide sufficient support to the grassroots in terms of manpower. The HKCSS, LE Commission, etc., as to whether we can form a working group. We would certainly look into the possibility. Hong Kong's labor force is in decline. The numbers are in decline, so it's important to review the overall situation. Reverend Peter Kuhn. Reverend Kuhn, it's your turn. Mr. Chao Siu-chung, Reverend Kuhn. Chairman, in terms of the minimum area requirement, increasing the requirement from 6.5 to 9.5 for those requiring a medium level of care, the minimum is only 8 square meters. For the 24-meter height restriction, it has been something talked about for years. If we relax the requirement from 24 square meters, the elderly residents can certainly benefit, or else the minimum is still too low. In terms of the manning ratio or manpower, since there is intense local competition, would you relax the import of foreign labor for certain positions such as carers? In terms of the manpower situation, giving priority to local workers is key to our policies, and we will look to replenish the local workforce as appropriate. At the end of the day, we are looking at the structural issue of a declining labor force. So I would defer to the SWD to address the 24-meter requirement. As for the floor height requirement, the height restriction imposed on Rchs is to protect the welfare of residents in case of emergency. We hope the care homes can evacuate their residents as soon as possible. Under the RCHE and RCHD ordinances, the Director of Social Welfare is empowered to exceed the 24-meter requirement if certain conditions are met by the care homes. Since safety is in question, any further relaxation must be studied carefully. Next, Mr. Chao Siu-chung, followed by Ms. Ilse Tang Ka-piu. Mr. Chao. Mr. Chao Siu-chung. Thank you. Undersecretary, Deputy Secretary, I support the government's proposal to revise the manning ratio. Like I've said on previous occasions, shortage of manpower would jeopardize service quality. In terms of the provision, this oversight provided by the SWD is really lacking. We know that the residential care homes find it hard to recruit, but this problem wasn't reviewed from the SWD's inspections. We all know that nurses are in great demand. Many private RCHEs want these part-timers to stand in whenever needed. So improving the manning ratio is how you can improve service quality. So in terms of providing inspections and oversight, would the government fundamentally improve the arrangement so that we can implement the proper manning ratio? Undersecretary, by amending the legislation, we want to amend the manning ratio. If there is serious shortage, we can please let us know so we can look into the situation. And Assistant Director, in terms of inspecting the care homes, we did a lot in recent years. Can you speak up, please? Ms. Wong, can you speak up? Can you speak up, please?
係。
好，或者我再講過啦嚇。咁關於咧，我哋加強監。
In terms of reinforcing the oversight on care homes, we have been working consistently. The licensing office has a multidisciplinary team to step up the inspections during office hours and non-office hours, and all the inspections are spot checks that are made without notice. For homes that are not performing, we would carry out strategic checks. If there are any contraventions based on the nature and severity of the contraventions, we would issue reminders or written warnings. In case of written warnings, we have adopted a new measure since 2018. We have uploaded the records to a website, and all these measures hope to enhance transparency so we will continue to refine our work. Ms. Elizabeth Quat, thank you. Of course, we would support an improvement in service quality for the benefit of the residents. I think whether the key is whether there is enough support and enough oversight. People are most concerned whether these care homes would close down, and if that happens, what would you do? So many facilities want to reinforce manpower, but they do not have enough space. So if the facilities do not have enough manpower, doesn't mean they have to close down. What is your assessment? And would the fees go up? So people are hoping for better manpower and service quality and shorter waiting time. So how would the government get it done? I think the key is to provide elderly residents with a dignified way of life in their care homes. The amendment would mean change for the sector or trade, especially for private homes. Many of them barely meet the current requirement, while for aided facilities, most of them will satisfy the amended requirements. So we would put in place a series of requirements and allow time for the operators to eventually meet the requirements within 8 hours. If they fail at that, they might have to admit less residents or choose to close down. I believe 8 years is sufficient. As for waiting time, the SWD has a web page in place. So the overall waiting time is 20 months. For aided homes, the current waiting time is 41 months. For bought place homes, the waiting time is only 8 months. And according to the SWD webpage, for male applicants, those who applied in November last year have been admitted. And for females, those who applied in August last year have been admitted to bought place homes. So it's about managing your own expectations So how can you ensure a stable supply of manpower? Both nurses and carers are in short supply. I would defer to Ms. Polly Kwok. The SWD is purchasing places from the Metropolitan University of Hong Kong for registered nurses. We would fully subsidize these students, and after they graduate, they must stay in the welfare sector in the first 2 years. Every year, we have about 200 graduates. Going forward, we will look to work with other institutions or the Metropolitan University to provide more such places for interested students, and this would maintain the supply of nurses. Thank you.
I have 2 questions. The legislation will have significant impact on private care homes, but in my personal assessment, at least 60–70% of private care home residents are receiving CSSA, so they are receiving a large amount of subsidy. So can government respond? They are not bought places or subsidized places, but in these private care homes, how many of these elderly people are being subsidized by CSSA? How much money is spent? Why do I ask? Because money has been spent, so we have the right to monitor them. So these care homes that are receiving a large amount of CSSA, there are policies, regulations to monitor them. Second, through this legislative amendment, there's 8 years of time. Can the government implement technology, big data to monitor, let's say, administrative work? Can we come up with standards? Can we use IT such that the care home staff can monitor very effectively? We'll see if our colleagues can provide a response. So this is exactly why it takes 8 years. They need time to upgrade hardware, facilities. They also need time to fine-tune their work procedures. So this is exactly as Chairman has expressed. We don't have figures for private care home residents who are receiving CSSA. I understand it's an indirect subsidy. Now, each Hong Kong citizen should receive the basic care, but we have not investigated whether they are receiving residential care. Well, Mr. Chung-hung, first of all, we approve improving the residential care home facilities, but we also need to use this opportunity to make some fine-tuning. We mentioned 24 square meters as one requirement. Now, if the average area per person has increased, and if the limit is 24 meters, then the number of bed spaces will be limited. So some care homes might not meet the requirement. Will that lead to failure or closure? We don't want to see that. So is there any room for fine-tuning 24 square meters? When you refer to safety, what aspect of safety do you mean? fire safety standards over the last 10 years have changed. So if the SWD, the Social Welfare Director, needs to amend or approve these changes, can we make it a regular requirement? This is mostly a fire service requirement. Yes, our fire standards have improved over the last decade, but we need to consider evacuation needs. We have not seen evacuation standards improve for a long time. For the elderly, they have to be evacuated in a wheelchair or sometimes in a bed. So if we don't have the technology to resolve this problem, then I don't think we can make any significant changes. So for non-residential units, we allow them to, we allow the 24 square meter limit, but it is out of fire considerations that we make these proposals. We don't want to see a repeat of the Taiwan incident. For the non-residential facilities, why can't we make it a regular requirement? At this point, we have to look at the individual circumstances. Our colleagues will look into this. We have to consider it thoroughly. Thank you for your input. Time's up, and your connection dropped as well. Time's up anyway. So thank you. I don't see any further questions. This topic involves legislative procedures, so I want to ask members, do you agree on having this paper? Do you agree with the proposals in this paper? No disagreement? If we agree, then the welfare panel agrees on this legislative proposal. We can proceed with the legislative work. It doesn't mean that you can't make amendments. It just says that we agree proceeding with the amendment. Well, that concludes this agenda item, AOB. We don't have AOB, so we conclude the meeting. Thank you.